Yeah, you can start Nancy. Okay, let me know when I can change the slide. We'll go next.
Sure, sure. I hope you can hear me.
Yeah.
So, thank you for attending this webinar. I just wanted to take some time off to introduce myself. And so I am Rincy Samuel, and I'm the manager of Roseanne Aesthetic Clinic. So I wanted to take this time to just speak a little bit about chemical peels, what they are about, and how helpful are they, how effective are they. And this is one of the most minimally invasive cosmetic treatments available today that have absolutely no downtime. So it's also known as over lunchtime, procedures, and people can get back to work, the next day. So to start with, what are they about exactly? So they are one of the most minimally invasive cosmetic procedures available today. It's nothing but a controlled erosionist layer of your skin, which is called the epidermis, using specific formula or a combination of acids based on your skin type, your skin color and your skin type, and these peels help to remove any blemishes, uneven skin tones, age spots, even fine wrinkles. So it does help to some extent to remove pigmentation. So, and this is why it is a very commonly used procedure, especially before attending a function or a or a party or something. So these kind of peels are very helpful to give you an instant radiant glow. So we can change the slide now, Nizam. Hello? Yeah, okay. So when these peels are done regularly, it will also reduce the tanning that occurs on the skin. Many times you would have noticed that your skin on the face, the color of the skin on the face is quite different from what is on your arms or on your legs or even on your back. So when peels are done on these, especially on the exposed parts of the body, your arms, your face, and your feet, you will notice that the tan that occurs is kind of fading away with very regular sessions. So, and when we combine these peels with a setting of microdermabrasions, which is nothing but sort of like sandpapering the skin, if I can put it in a very simple and crude form, it is nothing but a machine that uses certain kinds of crystals. Sometimes it is a diamond tip, sometimes it is aluminum oxide crystals to kind of smoothen out the skin. Sort of like sandpapers the skin, gives it a smooth texture and a feel, and gives you instant radiance and glow. So when these peels are combined with these treatments, you see, the radiance that you will see, the radiance is enhanced, of course. So peels are used like an instant makeover, and you can see visible results even from the first session, which is why it is very popular and many women opt for this. So this is something though that must be done, through a supervised, in a supervised form, not something usually done at home. I wouldn't recommend that, because we are using chemicals and some kind of mild acids. So a doctor would be able to understand the correct combination that is suitable for your skin type. So yeah, that is like a caveat that I would like to share. Okay, we can change the slide. So there are different types of peels available for different types of skin. So we have the most commonly used peels are alpha hydroxy acids, also known as AHAs, these glycolic peel, lactic acid peel, and these are the examples of the types. And then we have a different type of, a different segregation of a type of peel called beta hydroxy acids, and the salicylic acid peel comes under that. So sometimes a combination of this would be required for your skin, depending on your skin type. So a dermatologist or an aesthetician, somebody who is well qualified enough to have an assessment of your skin, will be able to identify which combination or how much percentage of combination of this acids are required that will give you the best results. So these are the mildest form of peels. Peels also come with a different degree of the penetration to the skin. Some of them are superficial, which is the safest to use. Some of them are medium, and some of them are the deep peels. At Roseanne Clinic, we typically stay away from the medium and the deep peels because they penetrate deep into the skin, and that should only be done under, it is actually very similar to a surgical procedure, if I can say so. So we do the superficial or the mildest form of peels, which is acting on the, only on the surface of the skin. Okay, next slide, please. Okay, some points to note because, not everybody is a good candidate to take this treatment. The doctor has to assess your skin and understand whether you're a suitable candidate. Now, what makes you a good candidate? I will give you examples where you are not a good candidate. So maybe that will give you an idea. If you have, any kind of wounds on the skin or any injuries on the skin, then you are definitely not a good candidate for that treatment, at least until that wound heals, because the peels will actually, it's like, slightly eating into your skin, it's eroding your skin. So we do not want to further damage the skin that is already injured or that is in the process of healing. So the doctor will have an assessment on your face and will be able to identify whether there are any open wounds. So there should not be any open wounds on your face. Also, a good candidate would be somebody who has, maybe a person who has acne, somebody with oily skin, somebody with dry skin, somebody with the pigmentation marks, these kind of things. Also, your, your diet and your habits, your lifestyle matter a lot, because what you eat is what reflects on your skin. Especially, you will be asked to, you cut down on smoking, because I'm sure you know that smoking definitely has adverse effects on the skin. So while you are investing, it's an investment in yourself, it's an investment in your skin. We also advise you on the proper, lifestyle changes you need to change so that you can see a long-lasting benefits on your skin. That comes down to your diet, your exercise, even, whether you're using hard water or soft water also. So we give you that level of guidance and advice as to what would be the most suitable for your skin. And to see very good improvement, you need at least 4 to 5 sessions at regular intervals to see considerable improvement. And for those users who are trying this out for the first time, we always recommend a patch test just to be sure that there are no allergic reactions, or there is no other, allergic reactions, and there will be nothing severe, but some people can experience itching, or some people who may be very severely allergic to foods or certain other type of medications. We just want to be sure that before we apply to your face, we will apply to some hidden area, maybe behind the ear, or underneath your elbows, or some hidden part, just a dot, just to see whether there is any adverse reactions. And if there is no reactions in 24 hours, we'll definitely tell you to go ahead and start the treatment. So the superficial peel is recommended for first-time users. This is the mildest and the safest peel because there's absolutely no side effects here. There's no downtime, and it has the fastest recovery period. So we have glycolic acid and lactic acid peels, more suited for dry skin and skin resurfacing, which helps to improve your skin texture. And as explained earlier, a very important word of advice, that it is always best that these peels or these treatments be under the watchful eyes of a doctor or an experienced esthetician who knows exactly the time required to keep these peels, because in any situation where a neutralizer has to be applied, or if there is a situation wherein it has to be taken off, the esthetician can immediately step in to undo the treatment, so that so that there is no adverse effects appearing. So this is why I would always recommend to get this done not just at a salon and spa, but with a under a doctor's supervision. So moving on, there are some precautions that we need to take before and after the treatment, especially if you're on certain type of medications. The doctor may ask you to stop them or pause them for some time, because your skin may become extra sensitive if you combine these peels with certain medications. So the doctor will advise you accordingly. And most important is to wear a sunscreen and cover your face, cover that area, the treated area, with at least a sun protection factor, SPF of 50+. This happens because after the peel, within 24 hours of the peel, what happens is the skin becomes reddish and sensitive. So the chances of sunburn is high. So we tell you to protect your skin. You can use an umbrella whenever you go out, or you can cover your face, or you can do something to protect your face in that area. So what is to be expected is the skin starts peeling. In the next 2 days, you will notice the skin starts peeling, and as it peels off, you don't have to exfoliate. Just apply a lot of moisturizer and sunscreen lotion, and within 2 to 3 days, you will see your face literally glowing and radiant. So this is the impact of having the peel done. So yes, we can move on. Okay, so just again, reiterating the precautions, your dermatologist will explain to you the procedure, what to expect, because during the course of treatment, there is a light, maybe light stinging sensation may be felt. That is absolutely normal and to be expected. But in any case where it is beyond a level of your pain threshold, then it has to be alerted so that we can do something to take it off quickly. But all these treatments have, just like if you were to ask what does it feel like while you're undergoing treatment, you'll have slight stinging sensation on the face. That is normal, because it just shows that the acid is working. That's it. And of course, yeah, you should be avoiding waxing or any kind of threading or any treatments directly impacting the skin at least a week before the treatment. We can change the slide. So the cost of the treatment depends clearly on the concentration of the acid used, and whether there are a combination of ingredients as well that is suited to your skin type. So for example, somebody getting treated for acne, which is severe amount of pimples, which I will show you in the coming slides. You can see a before and after also. So for acne treatment, obviously the formula or the combination used is different and of a higher standard or of a better type than that just for pigmentation or just something where you just want to sort of like get a glow to your face. So that will be different. So we have different types of fields for each of these skin conditions as well. It will cost you anywhere starting from 2,000 to 3,500 and sometimes even upwards. Hello? Yeah, I hope people are able to hear me.
Yeah, we can hear you. Please go ahead.
Okay, great. Right. So here is some of the pictures, as you can see, of the before and after of the treatment. And you can see that, it definitely, there is, these to see the after is happening after at least 4 to 5 sessions. 4 to 5 sessions. So here you can see that there is the first lady has some dark spots, some pigmentation marks around the face, some age spots. But after the treatment, she's definitely looking much more radiant. And you also notice on the arms, the hands are definitely looking younger and better. So just to let you know that even these treatments can work on any part of the body, even on your arms, even on your feet or your back. So there is no concern around which part of the body that can or cannot be treated. It can be, as long as the doctor advises so. And the third, you can see that there is this particular lady has had a case of acne, and it has left her with scars. So in this particular case, you will also notice that the scars have reduced to a great extent. So this is, the impact of the, chemical peels done correctly, done under the right manner, done under doctor's supervision. Okay, we can change the slide. So, yeah, this slide is again reiterating the steps that I had just explained earlier about how to take care of your skin post the treatment. So just reiterating the same points that I have raised earlier. You need to protect your face from the sun whenever you are outside after the treatment. You need to be sure that you are extra moisturizing your skin and wearing a strong sunscreen lotion. Use an umbrella or a scarf to shield your face. There's no need to exfoliate. There's no need for scrubbing or any kind of vigorous massage on the face, because your face becomes the face or the area that is treated becomes quite sensitive. So, please be gentle with your skin after the treatment. So the effects of the peel will last for at least a year. Those who have done about at least 5 sessions, you will notice that its efficacy, or the radiance or the beauty of that treatment lasts for at least 8 months to a year. Depends on how good you take care of your skin, which is why we advise our patients to cut down on smoking or cut down on the junk food, because all of these also add to your hectic lifestyle, and stress does add to how aged your face looks. So if you can cut down on all of that, it's basically a change in your lifestyle. You will definitely see a much radiant glow on your face for at least a year. And then thereafter we recommend a maintenance treatment every 4 to 6 months. If you can do at least 1 or 2, there's no need to do more than that. 1 or 2 every 4 to 6 months, you can have that sustained radiant life, in fact. So yes, we can move on to the next slide. So, so that session was all about, that was all about chemical peels, and the different types of peels, the kind of skin conditions it can help recover. And I just wanted to take this opportunity to share a little bit about what Roseanne Aesthetic Clinic is all about. So we have treatments for both dermatology as well as homeopathy treatments, and primarily we are focused on skin, anything and everything to do with skin, hair, weight loss, makeup artistry, camouflage makeup, dietary counseling, and all of these. And in addition to this, we also cover anything that is non-skin related, even those concerns, those people with concerns with arthritis or joint pains, respiratory problems, asthma, pediatrics also, even the children's teething problems, allergies. All of these we also address these because our doctor is quite quite expertised in these areas as well. So so this is what I would like to share about Roseanne Aesthetic Clinic. We are located at Hoodie Junction in Whitefield, and our contact numbers are mentioned here. Our contact numbers are mentioned here on the slide. Please do visit our Facebook page. That's www.facebook.com/Roseanne I-N, that's Roseanne In. And please do like the page. Please do put in your feedback, suggestions, comments, anything that you would like to know or that you want any information. Please feel free to contact me through my Facebook page. So that's all from my side. Thank you so much for attending this session. If you have any questions, please feel free to ask.